A Boy Scout's motto is be prepared. Are you prepared for the unexpected? Do you know where your Band-Aids are? Is normal saline a household item of yours? Do you have ice packs? Are they in the freezer? Or are they within the cooler from the last summer's picnic? Hello, my name is Genevieve Mancini, and I will be demonstrating how to dress a wound. Those were but a few of the items needed for this demonstration. The other items I have put on the clean surface area are the Band-Aids, some normal saline wash, smelling salts, antibiotic ointment, gauze pads, possibly swabs, those are optional, and gloves. And here are my ice packs. They're still frozen. One of the warnings, latex allergies, if possible. They have new products that are non-latex, and that would be very helpful to have around. Most of your Band-Aids now are non-latex also. Another warning is if you're bleeding and it is squirting out, possibly a vein, well, not a vein, but an artery has been cut. That is an emergency. You want to apply pressure and get that patient or wounded to the emergency department as fast as possible, or of course call 911. Oh, Captain Frank? Captain Frank just got back from a call. I'm at the fire department in Blowing Rock, and he does have a true laceration to his arm. So I'm going to wash my hands. Soap and water. You doing okay? You want to assess for bleeding just to make sure.
It is not bleeding.
Yeah. And I'm going to put on my sterile gloves. Troubleshooting, if your gloves are ripped, you could just throw them out and just grab a new set. We are going to place his arm in the sink, and I'm going to use tap water. That's an alternative in case you do not have normal saline. Will your watch get?
No, that's good.
Okay. The running water actually helps remove some of the germs and dirt. We're just going to place that in there and allow that to happen. Okay. Does it hurt?
No, that's
I have some treats if you're good. First thing I'm going to do is open a gauze pad. And there's instructions here. You're just going to tear across the top here. And you tear on the sides. And just lay it down like a book. Your normal saline, you can place on moisten your gauze, and you can gently wipe off and then toss in your trash. We're going to take another one. Same thing, remove, tear across, open it up, and just have a dry one, just a pat dry. And then you do want to assess the wound, look for some depth or bleeding. If it is bleeding continuously, you want to apply pressure for about 30 seconds, reassess that. If it continues to bleed, you want to apply pressure for about 20 minutes. If it's bleeding longer than that, you want to call your physician for some further instructions. If that doesn't help, then you want to apply pressure and again go to the emergency room. We're going to open up some antibiotic, and these are the Q-tip swabs, and they're sterile. You just want to apply a little bit of antibiotic on the wound. Open up a Band-Aid. Again, you want to start at this and pull down. This is still you'll see your white tabs. It's still like in a sterile casing. You're going to pull back on the white strips. Usually you should do one at a time. And you can place one over, get the other white strip, and just pat that way. And look, we used the minions. Okay, how does that feel?
Great. Thank you.
Thank you. Troubleshooting, if your gauze falls on the floor, just leave it there and open up a new pack. If your injured falls to the floor, you just want to continue your care at ground level. I'm trying to think. I think that's about it. I just want to wrap that up. Say thank you to the Blowing Rock Fire Department, especially to Captain Frank, Lieutenant Green, as well as Firefighter Sherman. Thank you. Look what we have accomplished. The wound is protected, healing has begun, and now that we have all our items together, we can actually create a little first aid kit so that you would have something there available for any other injuries that may occur, or you can take it with you out and about. Thank you.